Have you ever stopped to think about how much you rely on your eyes, or you only do that when something feels off? When you wake up, most of us, the first thing we do is we pick our phones, the screen, our laptops, whatever. Most of our life activities exposes the eye to various screens here and there. But then, do we really take care of them? Answer that question for yourself. You are warmly welcome to today's segment of the Sonia's Palace Show. The environment is different. Yes, we have stepped out today. We are currently at Legend Eye Clinic, located in Hokwe, specifically opposite the Subontin Rural Bank. When just a few meters away from Absa Bank in Hokwe, and we want to talk about eye health. Very, very important. Most of us don't pay attention to it, but then it's a crucial topic that has to be discussed. So today we have in the clinic the CEO and the optometrist in the person of Dr. Daniel Apedo to help us understand our eye health. Doctor, you're welcome.
Thank you very much.
Okay, today you are hosting us, so ideally you are supposed to welcome us.
Yes.
But then all the same, we welcome ourselves. When we talk about eye health, generally, what does it mean? Or what are we supposed to look out for as far as our eyes are concerned?
Thank you very much. I will first of all like to thank you for the opportunity to be on your revered platform. I've been following you for some time now, and I think you are doing a very great job.
Thank you very much.
Yes, you are doing so well. So sometimes when we talk about eye health, people might just think it's about seeing, but it is not only about seeing. It is the general well-being of the human body. Things that have to do with how you see, how you interact with your environment. Because if you can't see, you virtually are not able to interact well.
Yeah.
So eye health encompasses a whole lot, and there are so many things that as we go on, we might reveal about what the eye can even reveal.
Okay.
So eye health basically just means taking care of the eye, helping the body to be in sync with the environment.
Okay.
Yes.
So before we dive deep, I would like to ask you a personal question.
Yes.
Why this field? Why specialize in eye health?
Okay. So I was a science student.
Okay.
And as a science student, everybody inspires to be a doctor. Most of us will want to be doctors when you are in the science class. So getting to Form 3, luckily we had some students coming from KNUST and UCC to school to help us. And most of them talked about engineering, some of them talked about the other fields, and some of them spoke about optometry. And when they spoke about it and the possibility of being an entrepreneur after school, it made it, I started looking at it that way, because if you become a medical doctor, the resources you need to set up and the resources that are involved in setting up an eye clinic, when you consider them, it is easier to be on the eye clinic. And I think that with being an eye doctor, you can specifically direct your energies towards improving something. Personally, I was thinking that I will make more impact as an eye doctor, and when I started, I've never looked back, and it's been a great journey.
Oh, that's nice. So far, so good.
Yes.
Okay, so from what you just said, it means in the second cycle, that was where your dreams, should I say, changed? Or
yes. So basically, in the olden days, you see a doctor, and a doctor encompasses everything. The doctor is the midwife, the doctor does everything. But with advancement in technology and as society is improving, you know that you can specify and have a particular specification for for yourself. So
since we are talking about stories,
yeah,
can you share a patient's story, if you care to share, that changed how you see your field of work?
yes. So when I was a student, about some 15 years ago, there was a time that we went for. I've been coming to Accra for some of my clinicals.
Okay.
So there was this woman that usually comes with the husband. The husband just had a cataract, and after that, the surgery was done. And he's been bringing the husband all the time. And we've been asking this woman to also have a test. There were even times that it will be, maybe it will fall on some function, so we are doing a free screening.
Yeah.
So me, I can see everything. And she sometimes jokes that if not because of the buildings, she could be at Medina and see Accra Central.
How
because
possible?
She believes she could see very well.
Wow.
So one day she came, and so the man was discharged, and he went on, and his eyes was fine. The cataract surgery was successful. Some semesters later, when I came back, the woman was coming, and this time it was the man that held her hand.
What happened?
Apparently, the woman had glaucoma.
Wow.
All this while, and didn't know about it. And she didn't just have a test, and one day, glaucoma, with all its implications, the eye just went off. So that was when it dawned on me that sometimes it is not just about the patients and what they like. So I made it a point that for the government sector, when I was there, yes, when people come, I periodically just pick the ophthalmoscope and so let me just check for you. Because it's a simple test, and yet it can reveal so many things.
Even when they are not coming to the eye clinic.
People who just escort, sometimes the workers around, I say, oh, sit down, let me check the back of your eye. And a lot of them, sometimes you'll find some cases that if not for that intervention, they wouldn't have taken note.
Wow.
Yes.
And probably we have taken our eyes for granted for so long.
A lot. A lot. The unfortunate thing is that the eye is not like, if you tell somebody that you have a heart problem in your family, the following morning, all of them will line up in the clinic. They all want to check their heart.
Yeah.
But when it has to do with the eye, the people think, oh, I can see.
As far as I can see.
Exactly. They see today, the eye is painful, they close it. By the time they wake up, they can see, they think they are fine, they forget about it.
Okay.
Yes.
Well, so now let's talk about the business for the day.
Yes.
You mentioned glaucoma.
Yes.
What are some of the common eye conditions that are among us? If you can enlighten us, so we look out for them.
Okay. Okay. So mainly for us in the tropics. When I mean the tropics, for us who are directly on the equator and under the sun, what happens is because of our dusty environment, we mostly get allergies. And most of the allergies are caused by dust. So you have allergic conjunctivitis being the most common. And apart from that, you have refractive errors. Refractive errors are broad. So we have myopia and diet, which is short-sightedness. There is hyperopia. There is astigmatism. And some will include presbyopia.
These big vocabs, some of us,
yes,
have to take them one after the other.
I'll be breaking them down for you. So myopia is basically short-sightedness. So people are able to see things that are close to them, but when they are far, they don't see it properly. Then there is hyperopia, which is the opposite of the myopia. So they are able to see further away, but they can't see close. And the same happens to be presbyopia as well. Just that presbyopia happens in the elderly, people who are about 40. So you see they are struggling to read. Sometimes children will be joking with their parents that they can't see. Mommy, this thing too, can't you see? They can't thread needles. They can't pick. when they are picking through rice and stuff. And then there's astigmatism, which is a complex one.
Okay.
That comes with some headaches. Things look a little blurry. It looks like there are shadows around things. So these all fall under refractive errors. Then we also have glaucoma, which is one of the leading causes of irreversible blindness. What it means is that when you are blind from glaucoma, virtually there is no intervention.
It cannot be treated.
No. So if you have glaucoma, basically it is managed. The good news is that if it is identified early, yes, your vision can still be restored, you can function properly. Okay. But if we are identifying it at the end stage, that becomes a problem.
So when you see the end stage, what do you mean? Because
end stage means that by the time the person is coming, somebody is holding him.
Oh, okay. Okay.
You are waving at the person and the person can't see.
Okay.
Some of them can't perceive light. So that is the end stage.
Practically, you are being helped.
Yes, exactly.
When your sight is concerned.
Yes, yes. And also there is cataract, which we call TASI in Epe. So it's some whitish thing. Luckily, it is the leading cause of blindness, but it is reversible.
As compared to the glaucoma.
Yes. So there are more cataracts than glaucoma, but cataract is reversible. Glaucoma is not. So we can say that cataract is the leading cause of reversible blindness, and glaucoma is the leading cause of irreversible blindness. Yes. So there is also cataract, and then we have the other eye conditions, injuries, trauma, bacterial infections, and the rest. But the ones I've mentioned are the most common we see here in the clinic.
Okay, all right. From all you said, it means at any point in time, anything can happen to your eyes. So at what point in life should we be concerned and take screening and all of that seriously?
Okay. So I'll try to be as practical as possible here.
Okay.
Ideally, at least once every year, you should check your eyes.
Regardless of the age.
Regardless. Everybody at least once in a year. But, you know, with our timing and things.
I don't feel anything. Exactly. Why should I go to the hospital?
So I think it becomes sudden. It becomes urgent, and it becomes crucial if the symptoms are not going away. Yeah. You have a pain, you sleep, it's not going away. It's been there 2-3 days. Man, you have to, yeah. And then there is something unusual. You can see that. I used to see from this TV when I'm sitting here. Okay. These days, the writings are not, that is a call. Okay. You have to check it out. You are there and it feels like there are sand particles on the eye. We call it grittiness. Okay. You are there, nothing has happened, you are not hungry, your girlfriend has not left you, you are tearing. That becomes that becomes a concern. It's time you look out. Yes. Okay. Yes.
So ideally once every year,
yes,
regardless of the age, you should have your eyes checked.
Yes, it is important because there are some of the conditions that are asymptomatic, like glaucoma that I mentioned. Asymptomatic means they don't have symptoms. Okay. Yes, so there can be a lot going on in the eye that you don't know. Exactly. And especially for young people, there are some conditions that the eye can reveal, which are systemic conditions. There have been times that I was the first to prompt somebody about diabetes. Okay. There have been times that I was the first to prompt somebody about hypertension. Those can be seen, and during a thorough eye examination, you can see that this person, there are hemorrhages at the back, there are changes that are indications of other systemic conditions. And when you refer them to the hospital and they check, they find out they might have diabetes, they have hypertension that will have to be treated. So those are some of the benefits you can get from from just having a routine routine eye care without necessarily having an eye problem.
Okay. Yes. All right, that's fine. So how does our lifestyle affect our vision? Say our diet, our phone screen and all other things that we do.
Okay, so when you for mentioning the phone, so let me start it from there. Now, because of things that are going on, we virtually live on our phones these
Exactly,
days.
yes.
So because of that, those habits affect the eye. There is more eye strain. If you have refractive error, you are able to read normally. You can see things around. But when it comes to screens, then it becomes a problem, because you know the characters on the screen are made up of pixels,
Yeah.
small light particles. So resolving them takes more effort. So if you have a refractive error, it is easier for you to just see around. But when you are looking on the screen, it becomes amplified. It means that you need more effort. So that is when the refractive error shows more. So habits like using the screen means that your refractive state has to be on point. So you might need refraction, get your corrective spectacles to be able to,
Okay.
yes. Lifestyles also, like not having enough sleep. Ideally, we should all sleep at least 8 hours. It has other benefits for the body as well, but in our industrial world, it's not
Yeah.
that possible. So if you are not resting the eye properly, it also has effects. If you are spending so much time on screens, and then some of the foods we eat, sometimes we skip meals, sometimes we eat one line of food. Because me, I like fufu, so every day fufu like that, without any form of green leafy vegetables. It also doesn't help the eye. It also doesn't help the eye.
How does it not help the eye? Especially, let's say, one pattern of food.
Okay, so there are some vitamins that the body has to synthesize for the eye.
Okay.
Mainly vitamin A is necessary for good vision. So we get more of that from our vegetables.
Oh, okay.
Exactly. So that's how come it's necessary. That's why people erroneously think that carrot does magic for the eye. Because carrot is rich in vitamin A, but
the carrot alone cannot
exactly,
do the job.
it just provides some of the nutrients the eye needs. So fatty green leafy vegetables and omega-3 fatty acids, they also have the roles that they play in the eye. Yes. So our gboma is very useful, just as the carrot is.
The ayoyo and
exactly.
Okay.
The contombre, yes, they all play a role.
Okay. Is it true that eye problems are increasing among the young ones? If it is, what's going on? What are we doing wrong?
Yes. So you can approach that from two angles. Maybe one is awareness, and the second one is because of the works we do now.
Okay.
In the olden days, where our parents are mostly farmers, they are not using their eyes that much. So once they see under their cocoa tree, they clear it, they move on. So if you have eye conditions, they might not even know. But now that we are all reading, we are all doing clerical work, you are reading small things. Have you tried opening an account before at a bank?
Yeah.
You see the requirements they give you for.
You don't even read it.
Exactly. They intentionally do it like that, so you can.
Oh, okay. Oh.
So it is so small. Once you start those ones, yes. Once you start reading those things, that gives you more demand for the eye.
Okay.
Exactly. So it now creates awareness that, oh, we can't see. So that may be part of the reasons why we might think the eye conditions are increasing, but they would have been there all this while. And secondly, because of the works we do now, the screen time, opening, conventionally, the eye must blink about 7 times in every minute. Yes, but when you are looking on the screen and you are engrossed, the eye opens. So the eye is not even able to go round itself and has the rest that it requires. So some of those things might be the reasons why we might have more eye conditions now than before.
Yes. Oh, okay. So with this, what daily habits should we adapt to protect our eyes.
Okay, apart from the resting that I mentioned earlier, there is also a recommended rule which we call the 20-20 rule. 20-20-20 rule.
Okay.
Yes, which means that especially for people who use screens, for every 20 minutes that you are looking on the screen,
okay,
you look away about 20 meters for about 20 seconds. It's a magical way of relaxing the eye.
The eye.
Yes, there is the eye focuses only when it is looking near. The eye rests when it is looking far away.
Okay.
So if you've been looking on your computer or you are reading for a long time, it means you have engaged the eye. The eye is not resting. So by looking away, it helps the eye to relax. For that 20 seconds, you come back. So that's why it's 20-20-20.
Oh, okay.
Yes.
Okay. So aside that, any other thing to be done?
You rest the eye as much as you can, and then you check up.
Okay.
There's a lot you can. I can't.
But then the most important one is you have your eyes checked.
Exactly.
Once every year at least.
At least.
Oh,
at least.
Okay.
If you are somebody who already wears spectacles or goes.
Please talk to me direct.
Who goes to the eye clinic?
Yeah.
You would have already been scheduled.
Yeah.
For maybe a yearly or 2 year.
Most
Exactly. So at least. It is not very difficult dealing with those people because even if you don't want to come, your spectacle is scratched, you will come. But people who don't know, that is the target group. So at least once every year, you can make it your birthday gift. That's all.
On your birthday?
Yes, my birthday. Checkup. Maybe that day you want to do something else. So a day before your birthday or a day after your birthday, let it be a schedule.
Okay.
So you have your medicals done, you include the eye, you check your teeth, you check your body. It helps. This is the only body we will carry. So
yeah, it controls the whole system.
Exactly. Okay.
Well, you mentioned when you spoke about the various eye conditions.
Yes.
So now we want to know whether some of them are hereditary or it just comes on its own as a result of exposure to some things and bad habits here and there.
Okay, so that's very important. So our good friend, glaucoma again. Glaucoma is hereditary.
Oh, okay.
Yes, so glaucoma runs in families. Luckily, it can skip some generations. So when you go to an eye clinic, ideally they should ask your family ocular history, what happens in your family. They should ask whether there is blindness. They should ask if they have glaucoma. Most clients will say no. So I will correct you that to the best of your knowledge or none that you know of. Because there are sometimes that glaucoma happens in your great grandfather. You might not know.
Someone you've not even met.
Exactly. Yes. So your grandfather may not have it. Your parents may not have it, but it might manifest at your time.
Why skip some generations and then
it's just
the innocent ones?
Yes, the selection. They will say that survival of the fittest. So once you are picking the genes, there are some genes that are left. So if you are lucky and you didn't pick the gene that is carrying the glaucoma, so you might see some people, their mother has a particular body shape, the children don't have it. They have not taken that one. So once you can leave that gene, it's possible you can leave disease genes as well.
Oh, okay.
Exactly.
I understand now because some of my siblings don't have any eye problems.
Exactly.
But then, so I went to pick something that I'm not supposed to pick.
And you have picked the better ones as well.
Well, that's okay. So what about those who rely on cultural remedies? What would you advise about that too?
Okay, this thing. All right. So there are some of these medications or cultural practices that help. There is a condition called acute hemorrhagic conjunctivitis, what we normally call Apollo.
Okay.
All right.
Hey, so Apollo's scientific name is that long.
So if you live by the coast, people will normally tell you that, oh, when you have Apollo, just fetch the sea water,
wash your feet.
Exactly. So those may help because the sea is highly concentrated with salt and the others. But there are so many other impurities in the sea as well, especially how some people treat the water by the coast. So you might be depositing a lot of other things on the eye just by trying to cure Apollo, because there are other debris in the water, there are other things. Some people may also, because we say most of these orthodox medications are extracted from plants, people might think that, oh, if I grind this and put it on the eye, but you've not been able to synthesize and remove the other debris, you are not using the right quantity that there is. So if there is no eye clinic around you, or there is no possibility of you getting access to any eye medication, you can try what you can do until you reach an eye clinic. But now that there is proliferation of clinics all over the place, I mean, when you have an eye clinic, just check. At least take advantage of the new clinics that are opening and are not taking consultation or are having, just check. Just check.
So my next question is a most asked question. Our eye health, is it some way, somehow connected to our mental health? And if something goes wrong with the eye, can it also affect our mental health?
Yes. I think that, not because I'm an optometrist, but I think that of the organs of the body, the eye is the most important. Personally, it's debatable, but that's what I think. So the eye gives you that psychological stability. Once you can see, at least, if you can't even hear, when you see people running, you can follow them. Exactly. So once you are not seeing properly, it affects your whole, people, trust issues come in. People give you food and you are not sure what type of food it is. Say, this, my children cry, they are tired of me, this food they have given me now. So it affects, of course, it will affect your mental health. It will affect your well-being as well. If you are not seeing properly, you might think you are a burden to people. You might think you can't, basic things, you can't be able to do them. Yes. So it affects. But that is to the extreme. That might be talking about total blindness. But if you can't see properly, there are times that it affects your productivity. So maybe you can read for an hour without getting tired. But if you have refractive error and the eye is doing extra work, you are having headaches, you are having eye strains, you read about maybe 20 minutes and you think you are tired. People around you might think, this lady is lazy. This thing that we are all doing on this computer, she has stood up already.
Sometimes headaches here and there.
Exactly. So that may also affect your productivity. And most children will also not perform well in school because they can't see well. So when you see such things on the, especially now that we are using whiteboards, they are not able to copy very well. The little light on the screen, there's reflections, and they are not able to see properly. Yes. So that can also affect their academics. Your children are not passing. Now that we are writing the BEC, if your child doesn't do well, everybody will be asking you, oh, what grade did your child get? And you might not be able to say it. It affects the whole family. You might want to have remedials done for that child. And probably it's just because of refractive errors or eye conditions, which spectacles could have solved.
So what are some of the signs of a serious eye emergency that we should never ever ignore?
So there is something called sudden vision loss. Yes. So that's an ocular emergency. You are just there and then you see that this eye can't see again. It wasn't going gradually. It just went off. That is an emergency. If there is an injury to the eye, maybe there's something pricked the eye and the thing is stuck in. So let me chip this in.
Okay.
If something perforates the eye, the best is to keep it height how it is. Don't try to pull it out until you get to the hospital. I know you might feel jittery, you might want to remove the obstacle. No. The content of the eye may come out with it. And then there is nothing else can be done. So it's better to send it to the hospital. Let the doctor remove the penetration for you. Yes. Okay. And also, so if there is an injury, if there is sudden vision loss, those are emergencies that you should act on. Okay. Yes, immediately.
Okay. So wearing of the glasses.
Yes.
I'm not asking for myself. I have had my own experiences.
Okay.
Does it make your eyes dependent or weaker over time?
Okay. So this is also one of the myths about the use of spectacles that we've been trying to educate the public about. So the spectacle is an aid to the eye. It's a visual aid. It doesn't weaken the eye in any way. It rather improves the vision. People will say that, oh, I could see better, but now that I'm wearing spectacles, the vision has become worse.
Yeah, somehow it affects the shape of your face. It makes the eyes go deep
inside.
Into
No. So it's in two folds. It's psychological. That's first.
Okay.
Because you were not seeing, and now you are seeing well with the inclusion of the spectacle. So you are now used to seeing very well. So when you take the spectacle off, you are unable to objectively compare how you are seeing now to how you were seeing before. Yeah. So you might think that, oh, I'm not seeing well. It's because you are now comparing how you are seeing to how you were seeing with the spectacle. That is just that psychological warfare happening. And in some cases, the eye gets worse. But it is not because of the spectacle. That is what would have happened even if no intervention were given.
Okay.
So let me take that again. So there are some conditions that are progressive.
Okay.
So let's say now you are wearing -1. In 2 years, you wear -2. In 3 years, you wear -3. I'm just using that as an elaboration.
Okay.
So if I give you spectacle when you need -1, after 2 years, you need the -2.
Yes, so you need to go forward.
You will now have to move forward. And having -2 means that you will not be seeing, you will be seeing worse than when you needed -1.
Oh.
So it is not because of the spectacle. It is the natural progression. And as we've been saying, the spectacles don't cure the refractive error.
Yes.
They correct it.
Okay.
And the correction only happens when you wear it. It's like how the makeup works for the ladies. You put on the makeup, it helps everything fine. But when you clean it, you go back to how you were.
The look.
Exactly. So the visual aids also elevate your vision.
Okay.
So basically, that's how it works.
Oh, okay. Time will not permit us to go more into details, but then probably we have to reschedule and come back.
Okay.
But then, before you give your final advice to our viewers, I would ask this question. If your eyes could talk, what are some of the complaints the eyes would say?
If I were the eye, I would tell you, give me a break.
Oh.
Yes. Let me rest a little. Because the eye is always working. Once you are awake, you can be relaxing. Your back is relaxed, your eye is still working. And as I said, the muscles of the eye are always focusing distance and exactly. So the muscles of the eye work twice every other muscle in the body.
Oh, okay.
Exactly. So by the time you are 40, yes, by the time you are 40, your eye muscles are 80. So if you are 60 years, know that your eye muscles are 120 years. Exactly. Because they are always going back and forth. So the eye should be telling us that they want some break. Yes.
Okay.
Yeah.
I know I said that before your final word, but then a question just came to mind with the glaucoma.
Yes.
Or does all the eye conditions should I say, affects an individual from a younger age, or there are age specific?
Okay, so like the presbyopia I mentioned, that is an age-related condition, usually at the age of 40. There are other geriatric conditions like age-related macular degeneration, but most of the conditions can start from infancy. Glaucoma, you can have congenital glaucoma. It means the person is born with it. Cataract, there is congenital cataract. There are some refractive errors that also happen just at birth, because refractive errors is as a result of the length of the eyeball. It's physiological. So those ones can also happen from childbirth. So an important comment too is that some parents will complain that they don't want their children to wear spectacles.
Exactly.
Because they are too young.
They are too young, yeah.
No. So once that has been certified that this child needs correction, please, they are toddlers that wear spectacles in the advanced worlds. Yes. So once the doctor can have that diagnosis done for the child, please, let's give them the opportunity to see the world better.
Okay.
Yeah.
Well, the sensitization is needed because, as you said earlier, the myth surrounding the eye condition is a lot.
Exactly.
And unfortunately, most of our parents have bought them and are working with them, so they don't allow the kids get tested as early as possible. And even if they are supposed to go for the glasses, as you said, they will tell you are too young, relax when you get to this age, or there is nothing wrong with you.
Exactly.
Because there is this child, he's currently experiencing some issues with the eye, and he complained to his parents. The dad was like, "You are just exaggerating. You've seen your colleagues wearing glasses, so you too, you would want to wear."
Exactly.
But the boy keeps complaining. In a situation like this, what advice would you give? What should the child do? The child cannot really do anything.
Exactly.
But then,
so it will all boil down to the parents. There are some kids that we call them malingering children. They come and they can see, but they pretend they can't see. There are ways we can find out.
Okay.
And then we can professionally counsel them.
Okay.
And sometimes we try to talk them even out of it.
Okay.
Because wearing spectacles is a lot.
Not for fun.
Exactly. The financial burden and all that. So sometimes we explain to the parents, if for some reason they want to get protective glasses for them, that is fine. But we'll let them know that this one is not because the child can't see. But you are a parent. You don't want to dare fate and find out later in life that your child could have done better with their vision done. So the best thing is just come to the hospital, let them have the examination done. And I'm sure that any professional doctor that is what is calling will tell you that this one is a malingering child, this one needs refraction, and one spectacles. Yes, we should be able to give you that distinction.
Okay. Thank you so very much,
Always
Dr.
welcome.
Daniel Apedu.
Always
so
welcome.
Before we let go of you, your final words of advice to our viewers out there.
Okay, so I would want to encourage everybody that eye health goes beyond just seeing. It encompasses the whole body and it's about your total well-being. So try and have an eye test at least once every year. There is so much benefit you can get from it, as we have already discussed. And because we are in Hokwe, we would encourage you that you come to Legend Eye Clinic. We are just opposite the Asubontin Rural Bank, and you will be attended to, and you will enjoy passing here. Thank you.
Okay, thank you so very much, Doctor.
Always welcome.
Well, you've heard it all for yourself. One very key thing I have picked is that your eyes are not replaceable. So, as early as you can, get yourself tested. Yearly, go for your screenings and then take it up from there. Take very good care of yourself, especially your eyes, because some way, somehow, it rules the entire body. We just want to thank you all for sticking and staying with us throughout the conversation. I believe you've picked one or two things from it and you have learned something for yourself. Now, if you have still not subscribed to this channel, Charlie, you are not helping us grow. We need to grow, monetize the channel so we can bring you more educative topics. So kindly help us grow by subscribing, share to your friends and family so we could all grow together, learn for the betterment of our lives. Thank you once again for sticking and staying. It's been the Sonia's Parlor Show, and today Legend Eye Clinic hosted us. As he said, if you are in Hokwe and around Hokwe, don't waste time. Get here, get yourself screened, and then whatever it is, Doc will help you take it up from there. Thank you very much. Until we come your way once again, keep taking good care of yourself.